An MRI report is not a diagnosis. It is one radiologist's written interpretation of a set of images. And for many patients, it sounds far more alarming than the actual clinical picture warrants. Welcome to This Explainer. Today, we're going to untangle one of the most stressful, heart-dropping experiences in modern healthcare. You know the exact moment I'm talking about, right? Your phone buzzes. It's a notification from your health app. Your MRI results are ready. Your doctor hasn't called yet, but that portal is right there, just begging to be clicked. So you click it, and suddenly you're drowning in these terrifying clinical words that make you feel like your spine is literally crumbling. If you've ever read your own MRI report alone in your living room and felt your anxiety absolutely spike, well, this explainer was made exactly for you.
I really want us to just pause and let that foundational truth we just talked about sink in for a second. The report you're reading, it's a highly technical description drafted by someone who likely hasn't met you, hasn't watched you walk, and hasn't heard your specific story. Yet, somehow, it dictates so much of how we feel about our own bodies.
Most patients today read their MRI reports before their doctor even has a chance to call. We've started calling this the patient portal panic, and it usually happens at the absolute worst possible time, doesn't it? Maybe it's a Sunday, or maybe it's 9 o'clock at night. You're sitting there completely alone reading words like multi-level, fissure, or stenosis, and immediately a backache that felt like a standard morning soreness suddenly feels like a catastrophic injury. Your mind just spirals. You start frantically searching the internet, but what you're experiencing in that moment really isn't a medical crisis, it's a communication gap.
We can actually take the terror out of these terms just by acting as your medical interpreter for a minute. These phrases sound incredibly serious simply because they're highly technical, not necessarily because they're dangerous. Take disc desiccation. I mean, it sounds like a rare disease, right? But it literally just means the disc has lost some of its water content over time. It's incredibly common with aging and often hurts absolutely no one. Or how about annular fissure? That's just a small split in the outer ring of a disc. Thecal sac indentation. Sounds like your spine is caving in, but it just means a change is mildly touching the nerve covering. Even something like central canal stenosis sounds catastrophic, but it often just implies a narrowing of space that might not be causing any issues at all. The vocabulary is dense, for sure, but the reality is often quite routine.
And this brilliantly illustrates our next core point. Imaging findings that get labeled as abnormal are remarkably common in people who feel completely fine. According to a major 2015 systematic review, disc degeneration, bulges, and signal loss become increasingly common with each passing decade of life. By the time we reach older age groups, the vast majority of people walking around with absolutely zero pain have these so-called abnormalities on their scans. A 2022 population-based study of over 3,000 participants backed this up entirely, finding that most individual degenerative findings on an MRI only had a really weak tie to actual pain. To put it beautifully, aging shows up on an MRI the exact same way wrinkles show up on human skin. It's simply evidence of life, not automatically a source of pain or a fast track to surgery.
Okay, let's move on to a number that might completely change how you view medical imaging: 49. It represents one of the most surprising and honestly critical findings in recent medical literature. In a fascinating 2017 study published in the Spine Journal, researchers sent a single patient, one person with the exact same spine, to 10 different MRI centers over the course of 3 weeks. Each center produced its own radiology report. Across those 10 reports, the radiologist described 49 distinct findings. But here is the absolute kicker. 0 findings appeared in all 10 reports. Not a single one. Only roughly a third of the findings appeared in more than one report. Now, this doesn't mean the radiologists were bad at their jobs. It proves that the lumbar spine is incredibly complex and interpreting these images is highly subjective. A small difference in how a radiologist words their report can drastically change how scary it sounds to you. So if you've ever wondered if getting a second opinion is just you being paranoid, it's not. The data proves it's a highly reasonable and smart thing to do. The really crucial point here is that the words themselves have power. Research from the European Spine Journal in 2021 and the Journal of Pain Research in 2023 showed something stunning: how a report is written literally affects how a patient heals. When patients were given a routine, heavily medical radiology report, they actually had worse recovery, poorer function, and more negative beliefs about their spine at a 6-week follow-up. But when patients were given the exact same medical information, contextualized as normal, age-related changes, like those wrinkles we talked about, they did way better. Reading terms like degeneration, tear, or collapse in an online portal directly increases anxiety symptoms, especially if you're prone to worry anyway. The words can literally make the pain feel worse.
But hey, what if we flip the scenario entirely? What if your MRI comes back completely normal or unremarkable, but you are in severe, life-changing daily pain? Well, that can feel incredibly gaslighting, like the imaging is calling you a liar. A landmark 2018 study in The Lancet addressed this directly, defining most back pain as nonspecific. This means your pain is incredibly real, but it involves muscles, joints, nerves, inflammation, or movement patterns that simply do not show up on a black and white structural still image. A clean-looking MRI does not mean nothing is wrong, just as an alarming-looking MRI does not always mean something is. The report is just one piece of a much bigger picture.
So how do we actually figure out what's wrong? Well, by building a clinical diagnosis. An MRI report is just step one. Think of it like a giant puzzle. To get a true diagnosis, you have to combine the imaging with the symptoms, the physical exam, the treatment history, and crucially, how the pain behaves in real life. Does it hurt when you bend? When you walk? When you sit down? Any single piece on its own is incomplete. The most useful interpretation connects all 5 of these steps together. Now, I want to be very clear here because safety absolutely comes first. There are distinct exceptions where an MRI finding demands urgent attention. If your imaging matches up with what we call red flag symptoms, you need a focused medical evaluation immediately. We're talking about progressive weakness in a leg or foot, numbness that follows a clear nerve pattern, a loss of your ability to walk over time, severe radiating leg pain that's getting worse, or any sudden change in your bowel or bladder control. In these specific cases, the imaging is incredibly powerful because the picture and the symptoms in your body are telling the exact same story.
But when those stories don't match, or when you're stuck in that patient portal panic, you need an approach that looks at the whole human. That brings us to the Vertrae approach. At Vertrae in Miamisburg, Ohio, Dr. Kamal Woods, who is a dual fellowship-trained neurosurgeon and spine surgeon, does something essential. He doesn't just read the radiologist's interpretation. He reads the actual images directly, right alongside your unique symptoms, your physical exam, and your history. The goal at Vertrae isn't to blindly chase every single finding listed on a piece of paper. The goal is to identify which specific finding, if any of them, is actually driving the pain you're feeling.
This is really the brilliant through line of their motion-first spine care philosophy, and it's summed up perfectly in this quote. The MRI shows anatomy, your story shows whether that anatomy matters. It places you, the patient, right at the center of the decision-making process, rather than letting a scary piece of paper dictate your future. A finding labeled moderate on the report might be totally unrelated to your pain, while something labeled mild could actually be the real culprit. Only your story reveals the truth.
So as we wrap up this explainer, I want to leave you with one final, really empowering thought. The next time you're looking at a medical report that confuses or frightens you, the most useful question to ask your doctor isn't, is this report wrong? The most powerful question you can ask is, does the picture actually match the pain? Keep that question right in your back pocket. Let it guide your conversations, calm your anxieties, and help you demand the focused, comprehensive care you absolutely deserve.